Well, there we go. So thank you so much for joining me. I'll just sort of go through some questions and the slide deck while you're still in traffic. And if you are able to get to your office, we can continue on in the product and so forth. So,
perfect. That'd be great.
Good. So with regard to these two courses, you don't have course names or numbers or estimated numbers of students, have you?
We have courses currently in these two areas that do have course names and numbers. I have new course names, but not new course numbers. So in terms of, I can tell you what we have currently in those classes, and what I predict we'll probably have in the future. It's a little bit hard to say what we're going to get for numbers in our first DNP cohort.
Sure.
But currently we have all of our students take advanced health assessment and advanced pharmacology, and we have approximately 100 master's students at this point. So we will probably get to that same number of DNP students, but likely start at a much smaller number. It's hard to predict what we're going to get in our first cohort.
Sure, I can imagine.
But I mean, given the number, I mean, just what we're thinking, I don't think I'm going to be that far off from where I am now. But I'm more likely to have part-time students as opposed to full-time students. So how many students I'll have in the course every year may be less. But they're all still going to have to take these same two courses.
Okay.
You know what I mean?
We won't need to worry about that too much. Do you know how long the course will be? Will it be a 14-week course?
It will be. It'll be a full semester. They're both full semesters. Advanced health assessment currently is taught in the spring semester in a traditional format, and then it's also taught in the summer in a 7-week concentrated version.
Okay.
But advanced pharm is always 14 weeks, 15 weeks. Whatever.
All right, and the advanced pharm is in the
spring. They're both spring courses.
Okay.
At this point in time, that's likely to change, but they're currently both spring courses.
All right, I'll write that down as well. Likely to change. Great. So you said that you had spoken with someone who was interested, who gave you a good report on Shadow Health?
Yes. They didn't. They only showed you the health assessment piece. That was the only. But they told me that there was something for pharmacology as well.
Good. And was this someone who was using it from a college?
No. I was at a national conference. They were exhibiting at the conference.
Oh, got it. Okay, great. Thank you. So you are. Let me just go back to this page. You are the Associate Dean of the Graduate Program, so you're not actually teaching these courses.
I am not, no, but I'm responsible for all the curriculum. So.
Got it. So what were you hoping that virtual simulation would bring to those courses?
Well, so a couple of things. Our current advanced health assessment course, one of the criticisms of the current course is that it focuses too heavily on normal. And we really need this. We need the course to change, and the new course outline is really looking at teaching more abnormal science. So I thought that simulation may be a way to help us with that, a virtual simulation. Advanced pharmacology has always been kind of a problematic course for us, and so I think anything that could make the course more engaging or anything would be a benefit. So. You know, they're very popular courses. They're very important courses, and I would like to see them enhanced. If nothing else.
Got it. Perfect. And so my next question is, it really isn't relevant. I was going to ask you what types of things that the students struggle with in those courses. That might be.
We have a little bit of an idea. I think that advanced pharmacology, so everybody takes the same course in advanced pharmacology, and we have a primarily primary care program, but we also have a nurse anesthesia program. So the nurse anesthesia students hate advanced pharmacology because it's been primarily taught by NPs and it's more focused on prescribing. So it doesn't, they don't feel that it's that relevant to them. We do break the class up into specialty-specific groups, and they do a kind of case studies in their area. The students just aren't really happy with the course. I think it's boring. I think it's hard to teach. I mean, this is their perspective. I don't know. I've never taught it. But it's routinely not had good evaluations. And it's a very critically important course. It's just really looking for a better way to teach the content and to get the students to learn the content. In terms of advanced health assessment, I think the students struggle less with that. But my real concern is that they come out of that course not really knowing much about anything but a normal exam. And they need to know more than a normal exam.
Got it. So I think that's going to be very helpful with this. Do you have a preference of which we start first? Should I start with the advanced assessment?
Yeah, maybe health assessment, because I have a little bit of an idea what that looks like. For the farm, I have no idea what it looks like.
All right, so you want me to start with the health assessment?
Right, because I mean I'm almost at the, well, I'm probably 10 minutes away now, and so.
Oh, okay, good. No, I'll just go over a little bit of the slide deck first. It's probably not necessary that you even see this, so no worries.
Oh, okay. Okay.
You to rush. But Shadow Health is an educational technology company out of Gainesville, Florida, and we have been the product leader in the virtual simulation market since we launched in 2012. And our founders sought really to create a platform to help nursing students improve their skills, where they would be able to practice in a safe and low-risk environment. And so we got input from numerous students and instructors and academics in the field, and we created our two cornerstone products, which are health assessment for undergraduate nursing students and advanced health assessment for graduate nursing students that you'll be seeing today. And all of our products really bridge the gap between what students are learning in didactic and what they'll be required to do in their professional practice. And we had a really nice response to those two products, and so we asked our faculty partners what other types of courses might benefit from virtual simulation, and we developed additional products in pharmacology, mental health, and gerontology. So right now in 2018, we have a suite of 8 products that are being used by more than 1,300 undergraduate tracks in the U.S. and more than 40% of the graduate nursing tracks in the U.S. And I think what draws colleges to this technology most is that faculty struggle with how to measure students' clinical reasoning. And Shadow Health products meet this need head on. We do provide faculty with measurable data, and we provide students and faculty with immediate feedback. The students are getting that immediate feedback right as they finish the exam in their most teachable moments so that they can continually learn and build on those skills. And then the students also express additional needs to practice and improve, and Shadow Health products really provide a realistic environment in which to do that. So your students are going to grow through practice, through self-reflection. They're going to be able to hone their therapeutic communication skills, become more organized and thorough when conducting patient assessments, gain confidence in performing physical assessments, and overall really improve their critical thinking and clinical reasoning skills. And we've been pretty proud of the acclaim that we've earned in the virtual simulation field, but what is really most unique about Shadow Health, and in fact the key element that makes our products what they are, is our our patented conversation engine technology. So we are the only virtual simulation on the market that allows students to converse in a 100% natural and organic way with our avatars. So they don't have the benefit of drop downs or pick lists or multiple choice menus leading the conversation. So these become really high fidelity simulations that challenge students just as they will be challenged in real clinical settings. So there's nothing to lead the conversation. They need to come up with their own questions to ask the avatars, and it really does lend itself to a very big increase in critical thinking. Conversation engine, why is it so important? It is important because this is what allows us to grade your students' clinical reasoning. So we are grading your students on 6 components, so the ability to collect subjective data, the ability to collect objective data, the ability to provide education and empathy when appropriate, the ability to process the information that they've gathered, so into a meaningful care plan, so sort of pulling all the pieces together. We're grading them on their ability to document an electronic health record and then reflect on their work and sort of decide, did I do right and what shall I improve on next time? So we do give you and the students what we call a digital clinical experience score. And we do have evidence-based research to back the grading rubric, and it's valid and it's reliable, and it's actually normalized to a standard deviation of 80%, so you're able to actually put that grade in your grade book if you so choose. And then when we get to the end, I'm going to show you the product and I'll show you all the scoring and how we actually do a deep dive to see how we come up with that grading. And the nice thing about this is that it allows you to kind of keep your finger on the pulse of how your students are doing individually, how the cohort is doing, and so forth, that you can remediate if necessary. So this program that you're working on, is that going to be online or on ground?
Mostly in person.
Mostly on ground. Okay.
On ground, yep.
Because I think online and on ground have kind of unique needs. So let's see. So then I'm just showing a slide of our integration pathway, so just sort of the steps that we would take you through if you decide that you're interested in moving forward with Shadow Health. Certainly nothing we need to get into too deeply now, but we're in the evaluation stage, of course, and this is the online product demo. If we get to the end of the demo today and you are encouraged enough to learn more about Shadow Health, I will provide you with a short 20-minute video called our research and exploration video. It's going to be very helpful for you to watch, so we kind of have to make sure we put time on the calendar for that. But it allows you to look a little bit into the evidence-based research behind our grading rubric, and it also talks about 4 questions that you'll need to consider if you are going to move forward with Shadow Health. So, for example, question 1 is, which assignments will I use? How will I sequence those assignments? How will I grade those assignments? And what kind of academic weight will I apply to each of those Shadow Health assignments and then Shadow Health as a whole? So that's the next step after today, is just for you to watch that video. And then once you're done with that, I'll get an email alert and I'll be able to give you test drive access so you can go in and play around. Would the summer is the summer going to be a good time for you to take a look at the product?
I think so, yeah, because since we've had graduation, life's a little bit better here.
Right, absolutely. So that's the end of that. I'm going to just move into the product. You're still in your car?
I am, but you know what? I'm outside of the university. I will probably be. I'm just trying to think. Is it easier for me to call back when I get inside?
I'll just kind of talk with you I'll see how much I can get just verbally. I think we're okay. Okay. So this next page we're looking at is a set of learning objectives for the advanced pharmacology and a separate one for the advanced health assessment product. I'll be able to send you both of these, but it talks about the learning objectives and the activities that the students will go through to meet those learning objectives and how that applies to each of our 5 patient cases in the advanced pharmacology and our 6 patient cases in the advanced health assessment. So you'll be able to have access to that. Will be great. So when the student logs on, there will be a number of assignments. They'll see the whole assignment list, everything that you have open for them. And the first one that they will see is an orientation. And this orientation is non-graded, but it is a mandatory assignment that the students need to complete before they can open up any of the assignments. And the reason behind this orientation, we really try to build the student training into the program. So it's a good way for the students to learn about Shadow Health, about how to interact with the avatars, about how they should get product help and so forth, so that then when they start the assignments, they're not having to learn that all again. We also have another non-graded assignment that is the Conversation Concept Lab, and it's just a nice refresher, especially for students at this level, to sort of refresh their memory on how to speak with patients and elicit subjective information. So it talks about open-ended questions and quantifying questions and that kind of thing to get them to thinking about how best to elicit subjective information from patients. And then once they get through that, they can open up any of the assignments that you have open for them. You will, with Shadow Health, if you decide to move forward, you will get completely free and completely individualized instructional design help. So they'll be able to take a look at your syllabus and look at all of the assignments and decide to sort of how and where to pop all those assignments in so that they, you know, you can make the best use of this product in your course.
Okay, great.
Yep, and that's very helpful. They've got so many, they have so much skill in doing that from over the years that they've got all kinds of sample syllabi and suggestions. You also have the ability to dictate what your benchmarks are. So the students are going to be living up to your benchmarks. You have the ability to change that in the portal. We also, there are a number of situations where we show your students' response next to model responses, which is really, really in them getting this immediate feedback. But you also have, as an instructor, have the ability to edit or even change all of that model documentation. So things that the instructional design team will show you when you get in there, you'll have, you'll be able to see every student's overview, and you'll also have a results book that'll show you all the students in your class or in your section, and then how they're scored on each of the metrics. So you'll be able to sort on those columns, so you'll be able to see the high, you know, the high performing students, and maybe be able to identify some that might need some remediation. So it's all very, very easy for you, kind of plug and play. See, where are you now?
I just parked my car, so so I'm trying to figure out. I mean, you're on my cell phone, so I mean, I could keep talking to him. Just thinking you're on speaker. I'm trying to get you off the speaker in my car. Do you want me to
wait for you to go into your office and log in?
You know, that's probably easiest. And so if you just stay on, then I can just come out and go in again, right?
We'll do that. And don't rush, please. I'm here, and I'll be back with you when you get back on the phone.
Okay, it'll be just a couple minutes. Thanks.
Hello.
Hello?
Hi, this is Susan.
Oh, hi, Susan. That was perfect. I think we're in a
Oh,
good.
good.
I'm glad you didn't rush, and don't want you to rushing on the highway or
Well,
what have you.
no, I got here and then my computer didn't have any internet access. I just couldn't believe, but then it did. So it's like, oh my God, I'm not going to be able to get in. But anyway, it's all good now.
Perfect. So you're able to hear me fine. You're able to see my screen now.
Perfect.
All right, good. So I think we got to a really good stopping point, just sort of conversation. What you're seeing here now is the overview of all of the assignments and learning opportunities built into the Advanced Health Assessment product. And so your students are going to be exposed to a variety of patients with rich medical and personal histories, allowing your students to really deeply refine their assessment skills as they move through those assignments. So on the left here, you're going to meet Tina. She is our virtual flagship patient, and she visits the clinic for a non-healing foot wound, a painful non-healing foot wound, and also to establish primary care. So your students are with taking a thorough health history on Tina, and over the course of the next 12 virtual months, in air quotes, Tina is going to come back to the clinic 8 different times for different chief complaints and allow the students additional opportunities to explore differential diagnoses in each of these single system exams. So this is sort of how you roll out your content in this system content.
It's, I would say, pretty close. Yep.
Good. So the other thing you need to know is you don't need to use the product in any particular order. You can use it across one semester, across multiple semesters, whatever really works for you. And underneath each of the assignments, you can see sort of an estimate of how long it would take to complete each of these assignments. On the right here, we have our focused exam. So your students are going to have 3 more patient encounters covering lifespan, gender, culture. Each of these patients has 1 primary and 2 secondary areas of study where the students are going to conduct multi-system assessments, again, as they work toward a differential diagnosis. And then in the here, the top, we have these some non-graded, interactive, and animated concept labs. They're really beautiful graphic ways to review the anatomy and physiology of each system. So the cardiovascular, respiratory, and abdominal, and really focusing on proper examination technique. So we do recommend that the students have a look at these. We also have this conversation concept lab. This is sort of a review of how to talk with patients. So, open-ended questions, quantifying questions, and that kind of thing, interview techniques. And then at the bottom, we have capstone assignment. So this is a complete head-to-toe that the student is going to perform on Tina when she comes back to the clinic 18 months later for a pre-employment physical. So in each of these assignments, just a little bit of a higher level of organization, high level of structure needed as the students will, build the mental model for their assessments. So all in all, in advanced health assessment, we have 5 patient encounters, or 5 patients. We have about 12 patient encounters and more than 21 hours of virtual simulation. So countless opportunities for transformative learning, of course, always in a safe and low-risk environment. So faculty are typically using the single system exams formatively, and then the focused exams and the capstone summatively. But again, when the course lead comes on, they can really determine with that, with our instructional designers, how they want to go about putting these assignments to their course. Any questions on that before we move on?
Nope, I think that sounds, no, I'm good.
Good. So when the students log on, they're going to see this page. It's going to have all the assignments that are open for them. And the very first one that we see here is a digital clinical experience orientation. I already talked about that. It's the where the student is going to learn about talking with the avatars. This is a conversation concept lab where they're talking about, finding the best ways to get subjective information. So these 2 need to be done first, and then the student would be able to open any of these assignments after that. You have control over when you open them and close them and provide all the students with feedback and so forth. So here we are in the health history assignment of the Advanced Health Assessment product. I've muted her right now, but who you see here in the corner, this is Diana. She is our virtual nurse preceptor, and she's going to be walking all of the assignments with the students, just helping them understand the learning objectives and so forth. So we're going to move on until we get to Tina's door. for. So the assignment here is the students are going to be interviewing the patient. They are going to come up with one or more differential diagnoses. They're going to prioritize those diagnoses and then come up with a meaningful care plan for those diagnoses. So Diana will be talking about collection. Again, they're going to be scored on their ability to collect objective data and subjective data and so forth. So before we go into the room, I want to orient you to the page. So on the right-hand side, we have the electronic health record. So this is where the students are able to document their findings directly into the provider notes section. So the identifying data and reliability, general survey, chief complaint, history of present illness, and so forth. And they can also read the information that is already in the patient's chart, and they can come over here and they can document the patient's vitals. So they can document in either full SOAP or SO format. And important to know that this work auto-saves every 3 to 5 seconds, so your students don't need to worry about losing any work. If the internet should flicker or they need to go out and do something else and come back, they will be placed right exactly where they left off. And at the bottom of the screen is a little instructions tab that we can open up. So if the students ever do come back and they've forgotten the learning objectives of the assignment, they can open this up and kind of a refresher and an overview. Here on the left, we have an exam menu. In health assessment, the only thing that in health history, the only thing we're doing is changing Tina's wound bandage. And then you'll see as we move along the assignments, it gets a little more complex here in the exam menu. So what you're going to see when we press Start Exam is how we make use of that conversation engine to get the information from Tina and how that goes toward the grading. So you see right here, this bar, it's pink. This is our one and only opportunity to greet the patient. And we basically click on the microphone here, and it's telling us how to use that. We're going to click on the microphone. You can say, "Hi, Tina, my name is Lisa, and I'll be your nurse today."
Okay, great.
All right, so we didn't hear her because I forgot to unmute her, but she said, "Hey." So
okay,
again,
I saw that.
Very, very powerful learning tool that allows the students to come up with their own questions, challenging them really to think critically. So let's see if you can hear us now. What brings you into the clinic?
I got the scrape on my foot a while ago, and I thought it would heal up on its own, but now it's looking pretty nasty, and the pain is killing me.
Sorry about that. I probably blew out your eardrum.
No, it's fine. It's fine.
So down on the bottom here, we have 3 buttons to press. So when we want to ask Tina a question, we use the white one. If that's the default, we can also educate and empathize, and this also goes toward the grading. So we can empathize with her right now. We can say, "I'm sorry to hear that you're in such pain, but we'll make sure that you have some pain medication before you leave here today."
I appreciate you saying that.
Good. So we can ask her some questions. How did you hurt your foot?
I was going down the back steps, and I tripped. I caught the railing, but I guess I kind of turned my ankle a little bit, and I scraped up my foot on the edge of the step.
When did you hurt your foot?
Well, I got the scrape a week ago, but the scrape and the pain got a lot worse in the last few days.
Okay, so we can come over here and we can identify her chief complaint, and we can actually document this, narrate this as well. So we might say, patient presents with painful non-healing foot wound after a fall. Good.
Great.
Patient tripped going downstairs 1 week ago. Turned ankle and abraded foot on edge of step. Pain has increased in the last 7 days. Then we might ask her, how are you taking care of this scrape? How are you taking care of the scrape at home? Okay, and this is a perfect example of a question. So these avatars, they know about answers to about 150,000 medically relevant questions, but occasionally we'll ask a question that the computer doesn't quite understand. So it will give us a couple of options, or we can ask a new question. But I think this one was pretty close to what we were asking.
I made sure to clean it and just keep it bandaged, and I put Neosporin on it.
Okay, so we can document that as well. So is this giving you a little bit of an idea of how the conversation engine works?
Yes,
Okay, and what are
this
your
is great.
thoughts about?
I saw some of this at the demonstration, but I'm sorry. What were you going to say?
I was just asking what your thoughts were about having them ask questions in this unguided format.
No, I think it's great, and it's exactly what they need to do.
Okay.
Especially now with more and more of the electronic records, really almost giving them the prompts themselves. So that often in clinical, they're not having to think on their own; they're following a checklist of questions to ask. So I think this is great.
And I've been told that even the electronic health records sometimes they have check boxes, but I think
yes, exactly.
With Shadow Health is sort of learn the old school way, so that when you go get the new school way, you really have that breadth of knowledge of how things are done. So do you think that
this is the way the rest of us learned.
Right, exactly. So do you think that practicing with these virtual patients will translate when they're working with real patients?
I would hope so.
Good.
I think
All
it's
right,
great. I mean, I think it's great. I really do like this.
Good. So we have this little arrow here, so we can open this up, and this is showing us the transcript. It's documenting every single thing that we're saying and doing. So when we introduced ourselves to Tina, it highlighted in pink, and when we empathized with Tina, it highlighted in blue, and if we educate, it would highlight in yellow. So this is all part of what goes into the scoring. And behind this little mark button, we have our conversation help. So when the students first start using Shadow Health, they may or may not have some issues talking with Tina. They can open up this conversation help just to get some tips. So for example, just using one subject at a time. Try to avoid pronouns. So if I said to Tina, how have you been taking care of it? She would not know that I was referring to her foot. So
her foot.
How are you taking care of your weight? One subject at a time. I see this a lot. People will say, do you use drugs or alcohol? And you would really need to make those two separate questions. So they can also they can contact support right from here. They get the email or the 1-800 number, and they can also report an issue. And this is important too. So if they keep getting some type of a text-audio mismatch, they can report that, and it goes straight to our tech team. And a couple of times a year, they have the actors come back in and tape some of the new questions and answers that we're putting into the avatars. So that's a kind of a nice thing as well. And we also have on the left-hand side, we have this interview guide. And this is something that you can include when you're using the assignments formatively, and you can take out if you're using the assignments summatively. So I'll just expand that. And this kind of tells us that we have about 104 pieces of information that we can get from Tina, and gives the student who maybe doesn't know where to begin a little bit of structure and guidance into what questions to ask. So you can see there's a lot of topics here, but we want to make sure that we're establishing chief complaint. It checked that off. We already did that. History of present illness. So it talks about that. So we didn't ask her yet to rate her pain on a scale. So watch to the left of this while I do that. Can you rate your pain for me on a scale from 0 to 10?
I'd say a 7. It hurts a lot, and the pain pills haven't kicked in yet.
Okay, so that just checked off. So a careful student will find out that Tina has a number of issues. She's got allergies, she's got diabetes and asthma that she's not treating, and so forth. So they might be able to go through all of these. And again, you can take this out completely when you want them to just rely on their own, their own learning to do the assessment. So we can ask her anything. Are you allergic to any medications?
Yeah, I'm allergic to penicillin.
What type of reaction do you have to take to penicillin?
I don't remember that well because the last time I had penicillin, I was pretty little. I think I got a rash, like hives. The doctor told me not to take it again after that.
Okay. And so we can also come over here. We can take care of her wounds. This is very basic. We'll just, this is the wound measurement, so we can add all of that information here. Swabbed wounds, lab for culture, and then applied new sterile dressing. So we'll continue to talk with Tina, getting all that information. And then when the student feels that they're done, they'll click End Exam, and they can move on to the next step, which is the information processing. I'm going to try to mute Tina quickly. There we go. So we're going to take all that information that we gathered, come up with one or more differential diagnoses. We're going to prioritize each of those diagnoses and come up with a meaningful care plan. And we start there. So what we're going to be doing is pulling lines from the transcript that support any diagnosis that we might make. So first we might want to say that she's in a lot of pain. So she's talking about the pain is killing me, so we'll click on this, and we might say acute pain of the foot. So we'll walk down the transcript and see what other types that she mentions. Pain, mentions pain here. She mentions the pain got worse in the last few days, so she mentions it again and again and again. So we'll attach all of those lines of the transcript to
okay, I get it.
diagnosis. And then maybe we have another diagnosis that she maybe is having an infection or something like that. So we can come down here, and the pain and the scrape got a lot worse. So maybe local infection of the skin and subcutaneous tissue of the foot. And again, we'll go find additional lines in the transcript to support that. And she actually has probably about 9 different diagnoses that the students can uncover. So there's a lot more conversation here than we're just moving through. And then we get to
that's great.
stage where we need to prioritize those diagnoses. So we might say one is high, the other is low, whatever we decide.
Yep.
And then we would be developing our care plan. So we'll start with the first one, and we'll start with acute pain of the foot. And we're going to read through all of these, and we might say, I think we assessed the wound. See what that was. Off that. And then we will, let's see, I can't find that one I was looking for. So we'll educate the patient on medications used for pain relief. We might educate the patient on non-pharmaceutical methods of pain. And we'll keep going down there. Then we'll look at the other diagnosis, the local infection of the skin. Start again at the top, and we might assess, let's see, here we go, the wound parameters. There we are, we found at that time. Intervene, we might labs, we might obtain a wound culture. We might prescribe an antibiotic and intervene we might clean the wound and cover with sterile dressing. So just a couple of examples, this portion of the assessment. And then when that is complete, it will show us here. It takes a couple of seconds to show us, but we will see an overview of what we put in the provider notes section. So one of the things that Shadow Health does is it always shows your students' documentation as compared with model documentation. So this student put a little bit here in chief complaint, and it will show you what an ideal documentation might look like. And again, this is going through all of these issues, her medications, her allergies, her asthma, her medical history, and so forth. So it really is when they get this immediate feedback, and they can go back into and really do a deep dive and read what's going on here, that they can go back into the assessment and apply what they've learned. So this is where all the kind of formative learning is taking place. All right, at the bottom here, we have a couple of questions. So in what ways did this assignment affect your ability to take a comprehensive health history? So we'll document something there. And how can you apply what you've experienced in this assignment to your professional practice? And again, they'll submit the and this is where the computer will start to score your student and give them a grade. What we're going to see on the right is that student performance index. So it's showing us that of a possible 156 pieces of information, we only gathered about 18. So it's showing us right here in the beginning level. And we have these benchmarks here that will show the student, explain to the student what it means to be beginning and developing and then proficient. So a student way up here would be probably a high A student at the time of graduation from your program. And we're breaking this down, so we're saying, you know, how well did the student do at collecting subjective data, objective data, providing education and empathy when appropriate, and then processing all of that information. And then down at the bottom, it will show us that we 12 minutes in the assignment, about 8 of those minutes interacting with the patient, and about 4 of those minutes post-exam activities. the student can actually print out or electronically get this lab pass, which sort of gives you all of the breakdown of that, if you want them to hand that in. And on the left side, you see this is our digital clinical experience score. So what this is doing is taking your students' results and comparing them with other students across the country who are using this advanced health assessment product. So it's valid, it's reliable. We have evidence-based research to back up the grading rubric, and this is also this is also scored. It's on a mean of 80%, so you can actually put that score in your grade book. But really, where the rubber meets the road is in these links down here on the left rail. So we're going over everything that the student did. I kind of almost think this is an assignment of itself to go through their results. They're going to go into the transcript, and you have this available as well. So again, where we educated and emphasized and so forth, you can actually divide this up so you can just look into the questions that the student asked and the statements the student made, and then the exam action, so looking at the vitals and so forth. And you would certainly not get this for every student, but if you have someone who's maybe in need of a little remediation, this could give you some really good insight into where what's going wrong. On the subject of data collection tab, we can see that there were possible about 104 pieces of information. We only collected 9. So we see the scored items on the left indicated by a bolded check mark, and we see the points that we received for those scored items on the right indicated by this bolded bullet. So the ones that are non-bolded we missed. But the nice thing about this section is that we can hover over any of these bullets and see why that would have been an important line of questioning, and also see an example question that we might have asked to get to that information. So we asked her about details of the pain, but we didn't ask her really to describe the pain, and why would that be important? We didn't ask her if the pain was radiating into her ankle or if she's has the ability to put weight on her foot. So all this was important, and when you go through the results, you can find out why. And when we look at all of Tina's history, we know that she's got some medication allergies and other kinds of allergies, and we can go into, you can see how the student can spend about 95 minutes doing this health assignment.
Sure.
So what are your thoughts on the immediate feedback in general?
I think it's great. No, I think this is great. We have a lot of students who are brand new nurses in our nurse practitioner program. We have a direct entry program. So a lot of them have had very little experience talking to patients, have had very little experience with sick people, or people in general. So we do find for some of them that the communication piece is really difficult for them to establish, and they don't really even know where to start asking questions. So, I mean, I can think of a million reasons why this would be helpful, kind of across the board.
Good. And I think it's important because you're probably getting students from all different walks of life and experience backgrounds, and it enables you to sort of level them a little bit. You just start here and you know everyone forward on the same page. Right.
I like the idea that there are, there's cultural and diversity mixtures, because, we often find that we get very little, the students don't always have an opportunity to see many diverse or culturally diverse individuals in practice. I mean, in their clinical practice as a student. And that has come up a lot as a concern on their part. So I think that at least even some simulation of some of that diversity is helpful.
Good, good. And what do you think about how we're breaking down this subjective information here, the subjective data collection?
I think it's good. I was thinking a little bit about the difference between the chief complaint and the history of present illness, and so, and I think it would I would just want to spend a little time with it myself to see how the system sets them up separately, and I think I like it very much. I mean, I have no trouble with this format. This is the way we teach the students to take history, so this is, it's fine. Yeah, it's fine.
So yes, when you get done with this, I will provide you with test drive access. You can really get a deep dive. We do ask that you go through, you'll need to go through the orientation, but we ask that you go through at least another assignment other than that concept lab through to the end, so that you can see how it's scored. And we don't
Yep.
really have much on this objective data tab because we just inspected her foot wound, but we would have
Right.
marked that information there as well. And then when the students go in and do the respiratory exam and the abdominal and so forth, you'll see a lot more information in that tab. With education and empathy, there were approximately 11 different opportunities for the student to provide education and empathy, and this is the key right here. So it shows times that we did ask about that and we followed up and provided education and empathy. It shows when we had the opportunity to provide education and empathy, but we didn't follow through, and then when we absolutely didn't go down that road at all, so we didn't encounter that opportunity. So it just shows us,
Right.
you know, what we were talking about with the lines of the transcript, and we said, we're sorry to hear that you're in such pain. And again, a model statement. So what are your thoughts on this, just being able to compare your students' documentation against model documentation?
I think it's great. I mean, the problem for the students is that they don't get much. The documentation piece has really fallen off. We've noticed in the last couple of years as there's more and more electronic records in the clinical placements, and not all the students can document because the preceptor sometimes has to do the documentation, and a lot of it is, you know, this much more checkbox kind of thing, and so they don't always have the opportunity anymore to really think through this and document it the way they're thinking of it. So this actually makes sense, and I would say they never think about the fact that they're empathizing, or they rarely think about it because it doesn't get documented at all. So it's I think it's great. No, I'm
It definitely
happy.
gets them in that. And I don't know if I mentioned to you, because I've already had a demo earlier today, but you have the ability to edit or change any of this model documentation in your instruction.
Oh, okay.
So the documentation tab, where the provider notes again, our documentation against model documentation on each and every one of the tabs. So what I was learning when I came on board with Shadow Health back in January, I was doing all these and I was putting, you know, a couple of words and realizing, oh my goodness, there's really a lot more to this. And I'm sure that the students will have the same situation.
Right, and you know, and in reality, when they're done, they may not always document like that, but they need to do it as students. I mean, I say this to them all the time. You can't tell me that was negative. You can't say, you know, normal abdominal exam. Well, what's a normal abdominal exam? You don't have any experience with a normal abdominal. Explain to me what an exam is. So, you know, that's what we really need the student to document over and over again as students. But you know, you're right. When you've been in practice for a while, you say normal exam, but I know what that is. I don't know that they know what that is, and so I think that this is, you know, really very helpful in terms of looking at that kind of extensive documentation until they kind of understand what it is they're supposed to be getting.
Precisely. And then you have the ability to reopen the exam either for an individual student or for the whole class, and they can go back in and apply what they've learned. So that's really the important part. And then they just have their self-reflections here. So that is pretty much it in a nutshell. Of course, it would take about an hour and a half to get that. So, and this is what your the lab pass, and this is what the student grade book would look like. So you'd have all of your students down here, all of the metrics over here. You can reopen for an individual student or for the whole class. You can break it down by section. You can export the results to a CSV file, and then again, you can edit. So lots of other hints that the instructional designers know that I don't.
Do you know if how this works in a system with Canvas? We have Canvas. That
you can put a link in.
So
Canvas.
could we put a link in Canvas to this? That's what I'm assuming we'd probably do. Because
this is all web-based, so you would put the link in Canvas.
Okay.
We'll end up going out to the web to do that.
Perfect.
Do the respiratory, so this is a little bit different. So now she's in the clinic getting a respiratory examination, and you know, we see the electronic health record on the right, but on the left, the exam menu is, you know, much more robust. So with the ability to inspect, palpate, auscultate, do a pulse ox, a spirometer, and check her inhaler. And so when we open up something like this, you'll see exactly what you need to see. You'll document it over here, and it will document in the transcript, check patient's inhaler. Maybe we want to auscultate her breath sounds.
Right.
Mute. hear this. And you notice when I did that, this area, auscultated breath sounds, opened up, so we have the ability to just document whatever we find here,
Okay.
and with whatever lobe we're listening to. So we'll use the body map down here on the left, and we have these little blue diamonds. That's where we'll place our cursor, and that's where we will be placing our stethoscope on the patient's body.
Okay.
So let's see, we're not hearing that. Is he hearing that?
Battery, hi, connected
There again.
to LISAPARDN.
So it's showing us, you're showing the student exactly where they need to place the stethoscope with those. I'm not sure why we're not hearing those sounds, but this is interesting because this is where they will hear the abnormals. We can also
that's what I'm looking for.
Auscultate in the correct
Great.
order and so forth.
So would the faculty need to check off what they want to hear, or this is where the student is checking off what they've heard?
The student is checking off what they've heard, and then they will be scored on correct or incorrect. So she does have some wheezing and so forth. All of that. And we do have, again, the conversation help here. We can open up that transcript, and we do have the interview guide. It's a little bit different now. So, we can start again by establishing chief complaint and present of her onset of symptoms and so forth.
Great.
So when they're ready to end the exam, I'm sorry you couldn't hear that.
That's okay. That's okay.
And so when you get into that test drive, you'll be able to take a look at all of this. There are a couple of questions on lifespan here. So, for example, Tina's second cousin was diagnosed with asthma at age 5. What would be included in your treatment plan? Put some information there. What factors might concern you related to compliance? And consider that Tina's uncle is now 68 and has smoked heavily every day since he was 15. What would you expect to find in his respiratory assessment? Just factors like that. And then just a very few NCLEX style questions here.
Great.
Multiple choice. And then, suppose that while auscultating, you assess if he scattered expiratory wheezes. Why would this be an expected finding for a patient with history? So we just kind of move through these questions, and then again, they're going to get that score. So there's the documentation.
That's great.
Our response next to the model documentation. Quite lengthy.
Right. No, I love the model documentation is great.
So then a couple of reflection questions. Explain the task it took to complete this exam and the clinical reasoning behind your decision. And this is also nice. Apply what you've learned to your professional practice. To pass those, so you can see the score again. So then, they will have a lot more information under this objective data collection tab here, but it's the same type of scoring. They'll come in here and they'll be told, well, we didn't inspect the chest. Again, this is what we should have done. We got points for and what we missed. So we said no as-if sounds, some wheezing. So that's helpful. The next thing I'd like to show you just real quickly is the cardiology concept lab. So this is just one example of those labs. There we go. Now we're hearing it. Can you hear that heartbeat?
I hear it. Great.
Okay, good. So I'm just going to go through this really quickly, but it talks about the physiology of a normal healthy heart. It shows how it looks within the cavity, the chest cavity. Beautiful graphics. We're going to explore all the structures of the heart. So those together and individually, we can even slow down the beating of the heart. So you're seeing those flashes. Those are the S1 and S2 sounds, and we can slow that down a little more clearly. And then we areas of auscultation, so exactly where the student needs to place that stethoscope to get the aortic sound. So they're going to place the stethoscope here, and the sound is generating from here, and we're going to see that corresponding blue dot here in the heart. So this is seeing it on the second right intercostal space at the upper right sternal border. So this is the pulmonic area. Again, where that sound is emanating from. The Erb's point area, here, the tricuspid, mitral, and then we start to get into some of the abnormals. So we have the ventricular gallop, so the student can listen to all the normals here, and then the abnormals on this side. Can you you hear that extra beat?
I can.
Good, good. So the atrial gallop. So this is one of the things you were mentioning, them not having too much opportunity to see the abnormal. Do you think this would be helpful?
I think it would be helpful. Obviously it's always great to hear it in real life, but to have some idea, they're all afraid of this, so that to have at least a little bit more experience in what they're listening for, I think is.
Right, and I've heard from faculty that these are really good sounds as compared with
They sound good.
On the internet, the pericardial friction rub. That's the one I would be nervous to find. And then
yeah, no, you would know that was a problem. Yeah.
Right, that's horrible. And then it ends with identification activity where the students will be given the normal and the abnormal. They'll have to determine which abnormal sound they're hearing.
Okay, great.
An example of one of the concept labs. We do have the other two of these. They're always asking us for more. So on what you've heard so far, just an advanced health assessment, if I had to ask you to score on a scale of 1 to 10, how would you grade that? How likely would you be to incorporate this into that new course?
I would say, again, I mean, since I'm not the person who's teaching it, I can't say entirely, but I would say I'm very supportive. I'm saying like 8, 9, even perhaps higher. I liked it when I saw it originally. I thought it would be a great teaching aid. So,
excellent.
I think it would be a great addition to those classes.
Okay. Do you have any reservations or things that you didn't like that you saw?
No, not really.
Okay, good. All right. So let's move on to our advanced pharmacology. We still have time, right?
Yeah, we do.
Good, good, good. Okay, so this is an overview of all the learning opportunities built into the advanced pharmacology product. Again, your students are going to be exposed to a variety of patients. They all have rich medical and personal histories. It's going to help them deepen and refine their assessment skills as they move through those products. So in this assignment, we've got 5 patient encounters, each presenting with different chief complaints. We've got Debbie. She's 55 years old. She presents with COPD and an exacerbation of her symptoms. And students are going to learn how multiple medications impact the patient's physiology and how adjusting those medications in a patient with pre-existing conditions can really improve the patient's comfort. We're going to skip over Michaela because we're going to take a look at her in a moment. But we have Tanner. Tanner is a 30-year-old white transgender male who presents to his primary care setting for an opioid prescription for pain management. And so the students are really going to be able to provide the education to the patient on the dangers of using particular substances inappropriately or even sometimes when used appropriately. And they're going to learn the value of saying no to a prescription request, so non-prescription as a valid prescription choice.
Right. Can you hold on just one sec? Hold on just one sec.
Sure. Okay.
They don't flop. To getting to the phone. Yep. I'm sorry, someone just had a quick question.
No worries.
Are you there? Oh, okay, there you are.
Good, good.
Okay, great. Sorry.
We're on Anita. She's 72. She's a Black female who presents with chest pain, fever, persistent cough, fatigue. And students will really learn how to distinguish between symptoms of infection and similar side effects of medications. So they're going to really definitely understand the therapeutic uses and effects and risks of using antibiotics in geriatric patients. And then we have Aaron. He's a 38-year-old Asian Indian male. He returns to his primary care setting just for reevaluation of his cholesterol and diabetes care. So students are going to apply some critical thinking and establish guidelines to sort of help Aaron in his treatment, maybe educate him on some lifestyle factors that can help him manage his concerns.
Great.
And
great.
Again, span gender, culture, some relevant topics, the opioid crisis and transgender, some very common underlying disease states as well. So all of these patient cases meet AACN competencies. for advanced pharmacology. So they're allowing students to go through these patient cases, culminating in a prescription writing activity. So are these sort of scenarios that you would like the students to have experience with?
I would.
But, okay. So again, I'm very repetitive, but, and these are the learning objectives. So this is, I mentioned this when you were on this is a good thing to show. But we have, this is 2 pages. We have one for each product. I'll show you the learning objectives, the activities we include to get the students to those learning objectives, and how they apply in each of those patient cases. So I'll make sure to send that off to you. Again, just the assignment list, which is the first one that they need to go through. And here we are with Michaela. So she is 21 years old. She's a biracial, bisexual female college senior. She presents to her urgent care clinic on campus complaining of pain and burning during urination, increased frequency of urination, foul-smelling urine, low-grade fever, so forth. So we'll come here. Again, the same objectives, this objective data, subjective data, making sure to take all of her cultural concerns into account as well. So same type of thing on the right, the patient's chart. It shows here that she has hypersensitivity to penicillin. We've got the provider notes section. So here, just subjective and objective. And then it shows that she's got some antibiotic resistance in her community. So that's thing that they'll need to take a look at. And again, we're going to make use of that conversation engine and go ahead and interview Michaela. So again, we have one opportunity to greet her. Here. Hi, Michaela. My name is Lisa, and I'll be your nurse today.
Hey.
Good. We can hear her. I'm so happy. Feeling?
I'm really not doing so hot. I feel a little feverish, and it burns when I pee, and I have to pee basically all the time.
All right. Again, we can emphasize.
Yep.
Sorry to hear that. That sounds extremely uncomfortable.
I really appreciate you saying that.
When did your symptoms start?
3 days ago, I started feeling pretty bad. I was tired and uncomfortable. I kept having to pee, and each time I did, it burned. It was gross, too. The pee looked different.
Is there anything that makes your symptoms better?
I tried drinking less water so I wouldn't have to pee so much, and the burning would stop.
Okay, so we can educate her. I know you're uncomfortable, but drinking less water will not make you feel better. Oops, I didn't. I know you're uncomfortable, but drinking less water will not make you. Oh, hold on. Let's try this. I know you're uncomfortable, but not drinking water will not make you feel better. Anyway. All right. We were not in sync with that
I got
at all.
I heard you. You won't get points for that, but I see it.
They can take a look at her chart. It already says uncomplicated UTI. A culture was ordered. They've done a urine dipstick, which is positive, a pregnancy test, which is negative, and so forth. So again, we'll go into the documentation and document all of that. Let's try this. Can you rate your pain on a scale from 0 to 10?
Yeah, okay.
Okay, so we get the hint of that. Let's see. Again, we've got the interview guide here, same type of things. And then when we're done with that and we decide that we've completed our interview, we can go on to the next part, which is the medication selection activity. So this is a multi-step process. We're going to, we know that we want to prescribe one medication for her urinary tract infection and another medication for the pain and increased frequencies that they have. The students are expected in this assignment to sort of have the Hippocrates medical reference or some kind of similar guide open during this exercise. Will they have that available to them?
Yes.
Okay, good. And the students have 3 opportunities to select the correct medication. So we'll first start, we'll go with urinary tract infection, and we see all the different classes of drugs. We know we're not going to be prescribing penicillin because she has that sensitivity, but let's select one of the sulfonamides. We'll check on that. We'll click on that, and we will put that in. We actually know that this is the wrong answer, but we want to see what's happening. We're going to click on the pain and increased frequency. We will do non-opioid analgesics. And what we have, let's see, anesthetic. Okay, we have urinary tract analgesic. So we'll choose that one and go ahead. And then we submit, and nurse preceptor Diana will tell us what we did. We got 1 out of 3, so the medication we selected is not the best choice for Michaela on the urinary tract infection, but we did select the correct medication for her urinary tract.
The pain,
We'll come back here, and I believe it's this medication, nitroglycerin. We have to get rid of this one first, put that one back in, and then we'll submit, and we are told that that was correct. So that's excellent.
Good.
Next thing that we have to do is this is a patient education piece. Again, a multi-step process. So we're going to come in here, and we know that we're going to have to find 5 different pieces of information to educate Michaela on. So we will click in here. We know there are 4 here, 3 here. So we really have to prioritize. So we might say,
you can't just give them everything, right?
Right, we can't. We need to do that. So avoid drinking alcohol. I think an important one for Michaela would be to use a backup method of contraception and maybe the GI upset and take the full course. So they'll go through all of that. Do the same thing with the phenazopyridine. This time there's 4, and I think there are only 4. So we'll pop these in. Full course. First effects. Oh, you're in there here, orange. I think we've got that. And what we need to do is go back into the room and go into that list, those 2 lists we made one by one, and educate Michaela. So we'll say, please remember to take the full course of antibiotics.
Okay, but what if I start feeling better?
Even if you start feeling better, it's very important to take the full course of medication.
Oh, okay, that makes sense.
And then they'll pop the next one in, and we just go along that train until we get to the end. And again, they're having to come up with their own ways to phrase this. And then when we get to the end, I believe they have to say goodbye to the patient and say, we'll see you again in 2 weeks or something of that nature. So what are your thoughts on this? It's a little bit different from the first one.
Yeah, it is, and I hadn't seen this one at all. It's interesting. I wasn't thinking about it being. I don't know what I was thinking it was, but I actually like it. For our full-time students, they take health assessment and pharm at the same time, so there would be a lot of reinforcement of the material they're learning in advanced health assessment with this as well, especially if they were using it in both courses, or even if they weren't. The interviewing the patient, the trying to figure out what's, I like it. It's more comprehensive than I was thinking.
Good.
And it focuses so much on the education, which is, I think, what we really want them to be able to do with the patients is educate the patients about the medications they're taking.
And it's interesting.
So this would be helpful for our NP students. It would not help our CRNA students, but that's another subject for another day.
Right. But this is interesting because they'll need to ask Michaela about her sexual history, and the students will be nervous asking the avatar. So, they need to really become comfortable so that when they go out into the real world, they can ask these questions that might be a little bit uncomfortable.
Exactly. At least have had that opportunity. Yep.
Right. So the next stage is for us to do the prescription writing activity. So we will come back to the patient chart. We're going to enter the patient's name, Mila Henderson, and her date of birth, so 06/20/1996, and then we'll do one for each medication. So we'll start with the nitroglycerin coin, and we just bring this drop down and we select one for each. So we'll say strength, and the students will have to figure out which strength.
Those together. Okay, great.
Dosage, they'll have to decide, well, they only have one. That's our option there. Next one is frequency. Have to decide. Route. That's obviously by mouth.
Great.
Up here. We'll just go through one. Just like quantity, how many will we dispense?
That was one of the hardest things to get when I was a student. You had to figure out how many pills they needed in altogether, because it's not something you ever think about as a nurse until you prescribe.
No, there's so many things to be thinking about.
I know.
Refills, duration.
No, this is great.
And then, let's see, option 0.
Yeah.
Last one, I don't know why that's in front of us. Duration. We can't see that one. For some reason, it's behind the information. And then we move on and do the same thing for the second one, and then we have to.
Okay.
What is your assessment of the patient's condition?
Then we have to go back in and put in our initials and so forth, so complete that activity. And then they have a brief handoff here, so the nurse preceptor comes back in, asks for that assessment, and then recommendation monitoring. Then
Great.
it finalizes the assignment for us again. This one looks a little bit different. So, well, no, actually, this looks exactly the same. So we've got the student performance index and all of our ability to collect all that information. We have the patient teaching and patient prescription writing, medication selection, and then that DCE score. And then again, we've got the same type of thing in each of these tabs. We can see exactly what we need to begin. So this student, started on a good track and didn't really ask her about her fever, so that was important. Education and empathy, the same thing. There's a breast cancer, someone with breast cancer in her family, asking about hydration, which we did, and intercourse, safe sex, and all of that.
Yep,
The
great.
provider notes, model documentation. This was the debrief, handoff.
What you should say, right? Okay, great.
Right. So this is the medication selection, and it shows us what we got right on the first try, what we got right on the second try, and that's the third try. So for this one, we did get that right on the third try, both medications. If we didn't, you'd a lot of red in here, and it would tell us exactly what we did wrong. The patient teaching,
great.
So the nitrofurantoin, the phenylbutyrene, and then the goodbye. Did they say, we'll see you again in 3 weeks, or call the office if you're not feeling any better, and so forth. And then the prescription writing, we'll see what we did.
Which we did.
We got the patient's name and date of birth okay.
Duration 5 days, yep.
On that, we missed a field, so they took points off. And then at the end, our signature and date, so we missed a little bit of that. So it's showing exactly what we've done correctly and incorrectly. The other thing, I believe I brought it up yet, but we also have some med math assignments.
Oh, great.
And the antihypertensive lab. So the med, let's see, did I bring that up? Oh, I did. Good. Okay, I'll just breeze through this. Again, we have 3 of those concept labs. This is the antihypertensive concept lab. So we're talking about, what physiological factors affect blood pressure, the pathophysiology of hypertension, pharmacotherapies to manage blood pressure, and then the mechanisms of action of all of those different drug classes. So we're going to start with the thiazide diuretics. So this screen, what is the physiology of blood pressure? What is systolic? What is normal? What is systolic? What is normal blood pressure at any given time? And then we have this beautiful graphic that shows us, and we know that blood pressure is highest when the heart muscle contracts, and we know that it's lowest when the heart muscle relaxes. So we're able to see that in the pumping of the heart and the effect on the blood vessels as it's moving through the body. And then we get to this next screen of the factors affecting blood pressure. So we know there are 3, the systemic blood volume, cardiac output, peripheral resistance, and we're going to talk about adjusting those. So we can see the same graphic again, but if we raise blood volume, we see the blood pressure change there. If we change peripheral resistance, we see it change again. And if we change cardiac output, we see that when we change them all together, that there is a compounding effect. And then we talk about the pathophysiology. So, what really contributes to high blood pressure? So body weight, activity level, psychological stress, and so forth. And talking about reducing blood volume. So how do we do that within the body? So one of the first line drugs is a thiazide diuretic, and we know that they're generally well tolerated. They're pretty effective when they're used. And how do they work? They work in the nephron and the kidney by regulating the filtration and reabsorption of small molecules like water and sodium. So this is something that's very hard to understand when you're reading about it, but I think when you have the graph, it's just so helpful. So you're seeing the water and sodium go through and the filtration of those molecules, and then you click administer, and you see what happens. So it's blocking, the thiazide is blocking a good portion of that absorption. You can actually reset it, do it again, so you can see it more and more. You get that idea, and it's showing you the nephron and the kidney. It's showing you exactly where that's all happening. And then
wow, that's great.
Take a look at the effects. So we're going to administer. This is back to the other screen. So we're going to administer and watch what happens with the blood volume. That goes down. Set it and try it again. You can see that happening. And then we can also take a look at the renal system and how this thiazide diuretic is happening there. So we can, this might be hard for you to see, but the urine is sort of trickling, and when we administer, we see it speed up tremendously.
Oh, okay. Okay.
Both the muscular system and the renal system. When you get into your test drive, you'll be able to see that. And then just a summary of what we discussed. And then we're going to go back in. So we've just done what am I trying to say there? The reducing blood volume. So we'll do it again for peripheral resistance and cardiac output. And so they'll go through each of those classes to see that. And then that's great. I didn't bring one of those up. Let me see if I can quickly do that. Maybe we don't have that. I thought we had the med-math assignment. So my apologies there.
That's okay. It's not as important to me for the graduate students. The undergraduates are a little more focused on the med-math piece. Yeah, no, I don't really care about med-math with this group.
I think I'm thinking of the undergraduate version. That's why.
You might be, if you have an undergraduate program like this, that people would care about it there.
Okay, so you rated us an 8, 9, or possibly a 10 with the last one. Would this be about the same, or how would you rate?
I'd say, I actually like this a lot. Because I was kind of curious, like what it was going to look like, or how you would do this in pharmacology, and it's really, it's great.
So you were talking about adding maybe a more engaging resource. I know the content is pretty dry. Do you think this would suffice to make it more understandable?
I think it would, and I particularly like what you just showed me with the hypertension. And I mean, that's actually what they need to understand, and I think it's being able to see it visually does make it much more powerful.
Right, good.
So I would think that would be helpful.
Good. So the next thing that we talk about is price, and graduate products down here. So there's the advanced health assistant, the advanced pharmacology. And what happens is the first product that they purchase, whichever it happens to be, is $99. And then if they purchase the second product as well, they're getting a $10 discount. So that's $89.
Okay.
So
the students purchase this.
Right. And it shows up here the different ways that the students can pay. So the student can come directly to Shadow Health and pay with a credit card, or you can make it available at the bookstore, but you do know that they mark up pretty tremendously.
Right. We don't want to do that. Yeah. Or add it in the lab fee. Yeah.
Add it as a lab fee, so they're paying you when they register, and then you're paying for all of the licenses. Or some people have found grant money or something like that to pay for the licenses. So lots of different ways. What are your thoughts on the price?
So is it? I have just a couple of questions. So is it one license per student? Is that how it works?
Right. Every student individually licenses. The advanced health assessment.
And what about the faculty? Is there a price for the faculty? Like do I have to buy something?
Not at all. You can have any number of faculty with their own faculty portal. Again, page there. So it will look like this. They can, if they each have different sections or something, they can each come in here and, see everything that they need to see. They can reopen the assignments right from here. They can edit the thresholds or export this whole file to a CSV file. So it's completely complimentary for the instructors, as many as you have. And again, they're all onboarded with instructional design so that they know everything that you need to know and how to use this and get help putting this into their syllabus and so forth.
Okay, great.
So do you?
I don't. I don't think that sounds. I'm sorry. I know I'm talking while you're trying to talk. I don't think the prices doesn't seem that bad to me. I don't know what I was anticipating, but that doesn't seem too terrible. I'm not sure what our answer would be about how we would do it immediately. I mean, that's one of the things I need to think about a little bit. But likely, probably the easiest way I would guess is to have the student pay for it initially before,
Sure.
as opposed to do it. I don't know. You know.
Do you think there's room in there for them to pay? Like you're talking about the MSN track now that you're turning into a DNP. So are there already resources that you need to incorporate this with?
Well, I mean, we used to have a bunch of lab fees that we got rid of, and now we're thinking about, do we really need to reinstitute lab fees? So I mean, it's kind of a bigger question than I can answer today, because if we are going to reinstitute lab fees, maybe that makes more sense to just do it that way. But I would think off the top of my head, if I were going to do this soon without an answer to that question, I'd probably have to figure out some way for the students to do it. Or, I don't know. I mean, I guess I don't know the answer to that yet. I need to talk to someone who has more information about money than I do.
Sure. And how this works is they would come in here and purchase the product. They'll ask for their email address, their college email address. So then when they purchase the second product, it will recognize that they've already purchased one product and then give them that other discount.
Okay, great.
So good. And I think, if you're working on sort of starting this program or changing the program, this is a good opportunity to adopt something if you have the opportunity.
No, I think it is. I absolutely think it's a good time to think about it. So that's why I'm really glad that we were able to do this.
Good, me too. So same here. So this is, we're back to the integration pathway. I think I described this to you before, but we're on the evaluation stage, done the demo. Before I can give you test access, I just need you to watch a very short 20-minute video, this research and exploration video. And this is going to, again, the evidence-based research behind the grading rubric and give you some sample questions to think about if you do decide to incorporate this. So then when you do get the test drive access, you sort of have your brain going, to look very critically at the assignments. And again, we do hope that you go through it. You'll need to go through the orientation, maybe the concept labs, but we do ask that you go through at least one assignment through to completion so you can see how they're graded. And then after that, we'll decide if you're moving forward or not. So
great.
Time in the next week or so to watch this video so I can give you that test drive access.
Let me just actually look at my calendar. I think I can get to my calendar. Hold on. Let me just see if I can, in fact, get to my calendar. There it is. Okay.
Yeah, this is the last slide, so if you need to cut the
no, that's okay. No, I just had to go someplace else, but I have it. So next week, oh gosh, this is awful. The next couple of weeks are a little tight for me. So how long did you say this took roughly to do?
Just 20 minutes.
Oh, 20 minutes. Okay. I'm just looking. I'm just going to have to book it in because that's the only way to be sure I'm going to get it done. You know what? I could do it Monday morning, the 11th.
Which Monday? Oh, the 11th. Okay.
Yeah.
Perfect. So Monday, June 11th, do you have time at 8 or 9? I have time at, I'm trying to think what's better. Should I do it at 8? I have both. I'm just trying to think which is the better time. How about 9? Then I'll make sure I'm here. I won't do it at home. I'll do it here. Okay. All right. That sounds perfect. And that's another thing that I didn't mention, but the students, this is a web-based program, really very few requirements. They need, I think some people with extremely old computers have difficulty, but it doesn't need to be very new. It doesn't need to be very fancy. You just need access to the internet. And you need to be on a Chrome browser because it's the Chrome browser that you need a Chrome browser, at a speech to text. So that's just about all. You got on pretty nicely at your work on your work computer, so that's great. So what we'll I use Chrome all the time. That's it. Yep. Good. So I will, after we're done here, I will send you 2 emails. So one will be sort of a thank you and frequently asked questions, and then I'll send you another one, follow-up meeting time. So you will have, before we meet the next time, you will have just watched that video and then I'll give you your test drive access and just kind of walk you through the first steps just to make sure you're comfortable, and then you can go ahead and explore on your own.
Okay, great.
All right, great. So any questions?
Sounds wonderful.
Adjourn or any other thoughts?
No, I don't think so. No,
Okay.
I'm glad that we did this. No, this is great.
Good. Thank you so much. And I know you were in the car at the beginning. It worked out. So
It did. It did. I couldn't believe I was driving. I'm like, oh my God. I picked up my phone and said, I hope it's 10:30 because I'm not going to be there for 10. And I'm like, no, it's 10. Of course it's 10. And then I'm like, all right, I'm going to have to do it in the car.
I know. No, I've done that myself, so I understand. So perfect. So thank you
great.
again so much for your time today. Expect 2 emails from me. If you have any questions, you know how to reach me, and otherwise we'll meet again on the 11th.
Terrific. Thank you.
Thank you very much. Have a great rest of your day.
You too. Bye-bye.
Take care. Bye.